What do you do if when you're getting out of bed, your foot hurts really bad? That first step, those first few steps, first few minutes are excruciating. You feel like you've aged about 40, 50 years overnight, and it hurts just to even move getting out of bed. What do you do? I've had a routine that I've had patients do for many years, and frankly, it can be a little bit confusing when you're reading through it. So what I want to do is I want you to watch this next video, and I want you to understand the routine. So I'm going to take you through the routine, and what you're doing is you're preparing your body for that first step out of bed. Whether you have Achilles tendonitis or plantar fasciitis or pain in the ball of the foot, if your foot hurts with that first few steps out of bed, this is a really effective way to be proactive and try to prevent having pain with the first step out of bed in the morning. Because if you start your day out with foot pain, you have a long day ahead of you. If you can somehow manage to not hurt in the morning, that's a win. Every day that you get out of bed that doesn't hurt, you're getting better. Every day that you get out of bed that you are feeling pain, that's a delay in your attempt to get better. And what we're trying to accomplish is we're trying to change patterns, change habits, and get the body to a point where you don't have to even think about getting out of bed. You just go to the bathroom when you want to go to the bathroom, you get up, you take a shower, go get your coffee, and you don't have to think about it. That's the goal. If you hurt when you're getting out of bed, you got to do something to not hurt. Okay, it's time to get up. I know that when I get out of bed, that first step is going to be excruciating. It's going to really hurt badly. So what I'm going to do is I'm going to prepare myself for the first step out of bed. Now, if it's the middle of the night and I'm just going to the bathroom, it's not going to be the same as first thing out of bed in the morning. The first thing out of bed in the morning is just going to take a little bit more time and a little bit more preparation. But if you're going to get out of bed in the middle of the night to go to the bathroom, my suggestion is to sit up first, and let's say my right foot is the one that hurts me. I'm going to leave my leg open. I'm going to take my thumbs, and right in the middle of the leg, right about this level, the bone is in the front, and right underneath the bone is the spot where you're going to hurt a little bit. And what you do is you just take your fingers, wrap them around the front of the leg, take your thumbs, and just very gently push into that area. You can take one thumb like this and put the other finger over it, and then circle your foot a few times, 5 or 6 times, or just pump it up and down. You're definitely going to feel some pressure. Have some Crocs, little elevated heel, something easy to slip into. UFO sandals will also work pretty well. So I'm going to slip into those, and I'm going to stand up, and I'm just going to wait a second, and then I'm going to just march. I'm going to lift my legs off the ground. So just a very gentle march, and then the first step is lifting your leg before you take that move. I don't want momentum to shift all that tension. I don't want momentum to shift all that tension to the bottom of my foot. So that's the middle of the night. Now let's see what happens first thing out of bed in the morning. All right, the alarm just went off. It's time to get up. If I'm next to a partner or spouse, I'm going to do my best not to wake them. First thing I'm going to do is I'm going to prepare my core to stabilize my midsection and my pelvis. So what I'm going to do there is I'm going to lift my knees. It's going to make it easier to get my pelvis into a better position. The goal here is to get your abdominal wall to stabilize your pelvis. If it does that, it's going to take tension off the hamstrings. Tension on the hamstrings leads to tightness in the calf, which shifts tension to the bottom of the foot. So I'm going to put my feet nice and flat on the bed. My knees are bent. And then what I'm going to do is I'm going to actually try to pull my belly button right down into the bed. If there's a low arch in your back, I'm trying to flatten that arch. I'm tilting my pelvis back. This is a hard move for some, and this is something you need to practice. And then what I'm going to do is I'm going to just extend my arms up, and I'm going to belly breathe. Now, belly breathing is in through the nose, out through the mouth. When I breathe in through the nose, my belly's going to come up. When I exhale, my belly's going to come down. And the reason that happens is because when you inhale and you're diaphragmatically breathing, you're expanding the lungs. Now, as you expand the lungs, your diaphragm is going to push down, which pushes the belly up. So diaphragm down, belly up. And as I exhale, the diaphragm comes back up and the belly comes back down. So again, feet flat on the bed, knees up. I'm going to extend my arms, which is going to allow me to fill better through my upper parts of my lungs. I'm gonna do this 5 times. There's no tension in my neck, and I'm just sort of reaching for the ceiling. And I might have to do it quietly if I'm next to a sound sleeper. Okay, now that I have the breathing out, it took about 15, 20 seconds. I'm gonna reach to the side of the bed where I have, waiting in the wings, a towel. You can use a band, you can also use the blankets, and my foam roller. So what I'm gonna do is let's now assume it's the left foot, just so you can see it next to the camera. I'm just gonna put the roller right here, mid-calf. I'm gonna rest my right leg over my left in the middle, and I can fine tune the spot. It's usually right in the middle, just by manipulating it with my heel. You don't have to sit up for this. As we get older, a lot of us older people tend to feel a little stiff and tight first thing in the morning. So I'm just gonna be nice and relaxed and lay down. And I'm just turning my legs side to side, and I'm feeling that roller as I work my way inside. That's where it's usually most sensitive. So I just go side to side maybe 10 times, and then I'm gonna circle my foot 10 times. The bottom foot is the one you circle. For coordination standpoint, you can circle both, it doesn't matter, but it's the bottom foot that matters. And I'm just gonna do this 10 times, 10 circles, it doesn't really matter. I'm just trying to get some blood flowing through those muscles the first time around. Then I'm gonna sit up. I'm gonna put the roller back down on the floor. And if I need to finish this up, I can use that little thumb trick like I did before. Now again, for showing on the video here, let's just now say it's the right side, not the left side. Now I'm gonna take my towel and I'm gonna do an isometric stretch, a little eccentric stretch and an isometric stretch. So I'm gonna put the towel around the ball of my foot, and for about 5 or 10 seconds, I'm gonna pull back, feel a little stretch in the back. Then I'm gonna push down. I'm pushing forward just a little bit, and I'm pulling back, and my foot is gonna stay in this one spot. Now for about 30 seconds, I'm just gonna push into the towel and pull back. Now I can just relax my head if I want, try to relax my shoulders, but I'm keeping pressure into this towel. And I'm building a little pressure. What this is doing is getting my tissues adapted, acclimated, whatever word you want to use, getting it ready for that first step during the day. I've already increased the blood flow through my calf muscle. Now I'm preparing the fascia or the Achilles tendon for that first step. So I do this for about 30 seconds. Now it's time for me to slip right into my Crocs or OOFOS. And I'm gonna, again, stand up. I'm gonna march in place once or twice, and then finally go to the bathroom. If you really have to go, speed up the process for sure. Once I've had my coffee or showered or whatever it is that I do in the morning, now I'm gonna do a more formal rollout, and I'm gonna do a more formal isometric stretch with a 2+ minute hold using the towel or band. Good luck.